Hello everybody, my name is Dr. Alice Ryrie and I'm currently a trainee working at the South London and Maudsley Trust, but prior to this was working with Sussex Partnership Trust. Today I'm going to be talking about the impact of the COVID-19 pandemic on the training of junior psychiatrists in the UK and what we can learn from this. So the initial years of psychiatry training are often the most formative, and during these years trainees will gain vital experience into different psychiatric specialties, as well as engaging in teaching and research opportunities. And it's often during this time that people will start to formulate their careers and build their portfolios looking ahead to higher training. As a result of the pandemic, there's been significant disruption to medical training across all specialties, but also our clinical services and working environment have had to go through major changes. So this presentation will be exploring the impact of the pandemic on the training of junior psychiatrists, and it will be reflecting on some of the lessons learnt, as well as what key outcomes and adjustments trainees would like to be carried forwards as we move into a hopefully post-pandemic world. So just a bit of background about the impact of the pandemic on mental health services in the UK, as well as on mental health in general. So, as I'm sure is the case across many countries in the world, there's been an increase in diagnoses of common mental health disorders amongst the general population as a result of the pandemic. And in the UK, this has been particularly notable in young adults, women, and in other vulnerable groups. For those with pre-existing mental health conditions, the pandemic has also had a negative effect, both in terms of their physical health outcomes and as well as their life expectancy, but also the lack of care provision has also been shown to increase relapse rates and worsen symptoms. In terms of our clinical services, there's been major disruptions across most of our services, with many having to shift into working with telepsychiatry, but also a lot of appointments and services have been cancelled or altered. There's also been a significant rise in referral rates, despite the fact that during early lockdowns there was actually a decline in referral rates, but this was because people just weren't accessing services or going to their GP, for example. However, demands on mental health services have begun to surge recently across the UK, and this is way above pre-pandemic levels. So how did the NHS react to disruption to mental health services? So these are just some of the most key points and the important steps taken by mental health trusts. So they've had to adapt services to complying with COVID-19 policies. Obviously that includes lots of changes to infection control, as well as caring for inpatients with COVID-19, which is something the inpatient setting wasn't really set up for at all. They've also done things such as setting up 24/7 emergency helplines because other services have been cancelled, and also our emergency departments have had to make dramatic changes, with some kind of opening up separate mental health A&Es, others creating COVID-free zones to try and see mental health patients in A&E. Pretty much all of our services have had to adapt in some way or develop new online services, and our home treatment models have also had to make significant changes, with lots kind of adapting to using video or telephone technology. Across the NHS there's also been operational and management changes, and some of this is planning ahead, as I mentioned, for this increase in future demand that we're already starting to see. The government has also announced a £500 million investment called the Mental Health Recovery Action Plan, which aims to support over 1 million patients to access services in the next year or two. And finally, there's been a focus on staff wellbeing and offering new support services, and this is both within psychiatric specialties, but also helping healthcare professionals from other specialties access this support. So how did this disruption impact on training posts for junior psychiatrists? So for many UK trainees, rotations were paused at the beginning of April 2020, and many trainees will have missed out on one of their rotations and stayed in the job they were in at that period in April. This means that for some foundation trainees and GP trainees, they were not able to rotate into their psychiatry job and then missed out completely on this clinical experience. Also, many trainees were redeployed to areas of higher clinical needs during the peaks of the pandemic, and therefore missed out on their clinical experience in psychiatry. And I know several trainees that were redeployed to, for example, medical wards or specialist COVID wards or hospitals when they were on their psychiatry placements. In April in August 2020, I was working with Sussex Partnership as a clinical fellow in inpatient psychiatry. And the next slide, I'm going to talk about some of the notable changes in which my experience was affected by the pandemic. So I thought I would split this into three main categories. So firstly, it was quite evident that there was a big impact on the way in which the clinical services were run. So a lot of this was that we started working with lots of online services. So our MDT would often Skype into meetings. Instead of face-to-face visits, often healthcare professionals would have video appointments. There were also lots of staff absences during this period, so some challenges in filling the rota or managing absences. The crisis team also had to make major changes, and that impacted on the way that we would refer to them. Some of my on-call shifts were working in liaison as well, so the way in which the A&E department functioned was quite different, so there were significant changes there. And finally, there was quite limited access to working in certain subspecialties if I'd wanted to access taster days, for example. Also, something that was very notable was how the pandemic directly impacted patient care. And obviously one part of this is dealing with the physical impact and risk of COVID-19 and kind of anxiety around that for the patients. Wearing PPE and trying to communicate with patients wearing PPE. Patients also had to isolate when they would arrive on the ward, which I think was quite challenging for lots of them. There were far fewer ward activities, and also their leave was sometimes affected if they wanted to do certain activities, like going to hobbies or gyms that they might have done before that were now closed. Visitor access was also limited at some point, so they weren't allowed any visitors at all on the ward. And also there were definitely notable delayed discharges and longer waits for admissions, which I think was quite a strain on the whole team. And in terms of the impact on my training, well, there was no face-to-face training throughout the year, so I didn't meet lots of my peers in person. Lots of sessions were cancelled. My on-call shifts often were covering gaps, so there was often being moved around different locations. There were fewer training opportunities in terms of things like extra talks or conferences or things like simulation sessions where you'd need lots of people in a room together. We did manage to have some medical students on the ward, but again, it was quite limited what they were able to do. And some placements didn't have any students at all. So kind of our teaching ability was also impacted. And finally, there were major changes in my application for further training. So there were no face-to-face interviews, for example. I thought I would also just talk about a case study of a colleague, so a CT2 at the time, who was working in inpatient old age psychiatry at the South London and Maudsley Trust, just to bring up their experience as well. So during their inpatient placement, there were multiple COVID-19 cases, both in staff and patients, and they found there were lots of challenges in encouraging patients to take tests and complete isolation, which raised some kind of complex ethical challenges as well. They, as well as me, they also noticed that there were COVID positive patients often prevented admissions to the ward and delayed discharges to the ward. And actually for them, eventually a separate ward was opened up, which was for just suspected or COVID positive patients. And lots of their staff were moved over there. So there were huge disruptions to their staffing levels. This person also spent time off unwell with COVID themselves and therefore missed out on lots of important training time and clinical work on the ward. They also had to move locations very frequently during their on-calls, and this was usually very short notice due to rota gaps. So were there also some benefits to these adjustments? I think it is good to think about some of the things that perhaps worked well or things that we would like to have moving forwards. So actually I think the fact that we were using more video technology or phone technology definitely improved efficiency quite a lot. So being able to have virtual meetings definitely allowed easier access to MDT discussions, so we could quickly, kind of short notice, arrange a meeting with the whole MDT, which previously trying to arrange that in person just wouldn't have been possible. Also, lots of patients preferred being able to access support and therapy online. And I think actually this moving forwards will be able to support a lot more people in the community. In terms of training, I think it's also good to note that some people found the flexibility in being able to access virtual training or online training really helpful. And this was often commented by people who were perhaps commuting long distances or had young children at home, for example. And this was actually really helpful for them. I think the greater focus on staff well-being and peer support is also something that we really should be learning from and trying to continue moving forwards. And finally, I suppose my experience is mainly in the inpatient setting, but including more robust infection control measures, as well as supporting patients with things like vaccination programs, is really important and definitely something we should continue, as well as kind of better rota planning for on-calls and trying to support juniors in terms of their on-call experience. So this is more general, so looking at the impact of training across junior doctors in the UK, and the evidence shows that there has been an increased rate of anxiety, depression and burnout in junior doctors due to the pandemic, and this is generally reported to be related to additional pressures on services, rota changes, concerns about PPE and redeployment to new clinical environments. There's also been major changes to specialty recruitment across most specialties. As I've mentioned, the loss of regular face-to-face training has also been shown kind of in the literature to have wider implications on trainees, and this is because there are educational and social benefits in providing peer support during these sessions. So the Royal College of Psychiatrists have issued guidance on how trainees can navigate some of these challenges. They've kind of structured this in terms of lots of different portfolio requirements, things like examinations, and they've also offered new support services for trainees. So whilst we can acknowledge that there definitely have been some major challenges during the pandemic, we've also been issued lots of support from the Royal College. So finally, what can we learn from this? I think it's really important to reflect on some of the key changes brought about by the pandemic on the trainee experience. So first of all, I think to say that we work in a field that is highly adaptable and has gone through many systemic changes. And I think the pandemic has really highlighted the impressive ability of our system to be able to make such changes and cope throughout it. As I've said, disruptions to training have undoubtedly had a significant impact on trainee wellbeing as well as future careers, and therefore it's really important that from now on we try and take steps to support trainees as much as possible and follow the guidance that we've been issued. But I think the main thing I want people to take away from this is that actually there have been some really interesting benefits that have come out of the COVID-19 pandemic, such as increased flexibility in online training, a greater focus on psychological well-being of staff, better infection control measures in clinical settings, better rota planning, and finally major innovations into implementing more telepsychiatry, which can improve patient access to care. So I'd be more than happy to answer any questions. Obviously, because this is a recorded session, I'm not able to attend in person as I'm in the UK, but I'd be very happy to answer any questions via email, and I'll leave this slide up at the end. I've also got some references, and I'm more than happy to email these slides to anybody that would be interested. So I'm just going to leave my email up for the last couple of minutes. Thank you very much for listening.